My name is Rizwana, and I am the lead pharmacist for Learning Disabilities and Autism in North East London Foundation Trust. So we cover the boroughs of Havering, Barking and Dagenham, Redbridge and Malvern Forest. So I've done quite a bit of work in trying to improve the lives of patients who have learning disabilities or who are autistic, mainly starting with the STOMP project, where we identified patients who are prescribed inappropriate medication, and we reduced this for them, and their quality of life hence improved because they weren't exposed to the horrible side effects that come with those medications. And then as the role progressed a bit more, I started focusing on how else I can make improvements in their lives surrounding medication aspects. And obviously a big thing that patients with learning disabilities and autism are entitled to have is the annual health check, which medication reviews forms part of that. So I work alongside Dr. Jyoti Sood, who will be joining us shortly. And we just came up with a project where we wanted to improve the qualities of overall annual health checks. So I, as the pharmacist, focus on the medication review aspect of it, but we also wanted to have a whole round improvement of the quality overall. And that's where you guys come in. So we want to explain to you throughout this teaching session and this webinar what makes a good annual health check, why the health action plan is really important, and how your role can help us to do that. So once we go live with the project, we will be measuring a lot of data, how many are completed, what the quality of it was like, getting patients and service users feedback, etc. But we just want you to feel supported. We want you to feel able to do them in a meaningful way, and we want to give you declining it. No. Just pop yourself on mute, whoever that is. Thanks. Yeah, so we just want you to feel supported in being able to carry out that role and giving you the resources and the skills that you need to do that. So we're going to have a few talkers go through a few aspects of what they specialize in and what they do, and I'll introduce them as we go on through the webinar. But before we do that, because we are quite a small group, I just thought it'd be really helpful if you could all introduce yourselves. So I'll just go on my screen one by one and just shout your name, and you can tell me what your name is, what your role is, and what PCN you come from, if that's okay. And I'll also introduce the speakers at the same time too, so everyone knows who each other is. So I'll start with you, Summer. You're first on my screen.
Hi, my name's Summer Cooper. I am one of the project managers at BHR CPN Training Hub. Nice to meet you all.
Thanks, Summer. And Hugh?
Oh, hi, I'm Hugh Jones. I work with a company called Maldaba, looking at the digitalisation of annual health checks. My PCN is East Yorkshire, so I don't live or work anywhere near the lot of you.
Neil? Okay, Jasmine?
Hi, I'm Jasmine. I'm a care coordinator from South Havering PCN.
Thank you, Jasmine. Lovely to meet you and welcome. Mary?
Hello, my name's Mary. I'm a care coordinator and I'm also from South Havering PCN.
Lovely, Mary. Nice to meet you. Caroline?
Oh, hello, my name's Caroline. I'm a care coordinator, also from South Havering PCN.
Nice to meet you, Caroline. Welcome.
Thank you.
Claire?
Hi everyone, I'm Claire, also from Maldaba. So I'll be talking to you a bit later about Hear Me Now, which is a communication tool which can support the delivery of annual health checks.
Thanks, Claire. Maggie?
Hi everyone, my name is Maggie O'Donnell. I'm the Learning Disability Nursing and Health Improvement Lead with the Learning Disability and Autism Programme with the NHS England in the London region. Nice to meet you all.
Thanks, Maggie. And then I've got Lisa. Oh, we can't hear you, Lisa. That's okay. Do you want to pop it in the chat? just give us your name, your role, and what PCN you work for. Thank you. Nazia?
Hello, I'm Nazia Muhammad Ali. I'm the care coordinator for East PCN Barking and Dagenham.
Lovely. Thank you, Nazia, and welcome. Neil, are you back with us now? No. Okay, and then I've got someone on my screen, RYP.
Hi, that's me. My name's Rafia. I'm a clinical pharmacist for Cranbrook PCN.
Lovely. Welcome, Rafia, fellow pharmacist. Really excited to have you on board. And Emma? Okay, and one more time to Neil, if you're with us, Neil. Okay, that's fine. So I'm just going to hand it over. We're going to start the session with the lovely Maggie introducing what annual health checks are like from an NHE perspective, and what she can offer and what resources they do in terms to help us as a national view in terms of annual health checks. Okay, thanks, Maggie. Over to you.
Thanks, Rizwana. So as I said in my introduction, my title is Learning Disability Nursing and Health Improvement Lead. So basically, health improvement covers just about everything. So I work around supporting people with a learning disability and autistic people with areas of health improvement around vaccination uptake, cancer screening, respiratory health, and annual health checks being a big part of the role that I do. So obviously I'm very keen, as overseeing that for the region, very keen to not only improve the uptake of annual health checks, but also to improve the quality of annual health checks, and to make sure that we're reaching everybody who has a learning disability and who should be on the register, because we do know that there is many people out there who have a learning disability but are actually not known to services at all. So, I mean, I'm sure I don't need to teach you this or tell you this, that people with a learning disability are disproportionately impacted by certain health conditions compared to the general population. So things like epilepsy, cardiovascular disease, respiratory conditions, which means they're obviously going to be more at risk of becoming unwell. So through our regional deep dives, we've actually seen that 48% of regional deaths that were reported were actually avoidable. So that's really quite concerning that there's that actual number, and also found that deaths from coronavirus in London particularly was actually higher than within any other area across the country. So one of the things that we've picked up on as well is that when deaths are being reported to the LEDA programme, so just for anybody that doesn't know what LEDA is, it's the Learning from Lives and Deaths programme that runs for people with a learning disability, and now autistic people who die, their death has to be get reported to that platform, and then they get sort of reviewed, looked at, and to see where we can actually learn from these deaths as such. So one of the other things that's been picked up on is the fact that annual health checks may not have actually been done. The person might not have had an annual health check, which again is, it can be a contributing factor in avoidable deaths. So basically the health check is really quite critical. It's a useful screening tool. It helps us to get a personalised approach and a holistic assessment of that individual. It can identify, early onset of health conditions, etc., and also, leads to a good treatment and management plan. So just regarding annual health checks for the region, the region has achieved the minimum 75% target of the uptake of annual health checks, and in the last year, the overall performance was actually up to 80%, which has actually made London the best performing of all the regions. So well done to everybody for playing your part in that. That's absolutely fantastic. But obviously as a region, and from my perspective, what we want to build on is actually the improving the quality of those annual health checks, so that people walk away with a meaningful health action plan at the end of the health check, and all practices are actually required to produce a health action plan. So it's a two-part process, the health check. It's not just about let's get the health check done. It's actually the second part of it is the actual health action plan. And that's sort of outlined in the Investment and Impact Fund, which forms part of the network contracted, directed, enhanced service. So we have to bear that in mind. And what's being reported is that there's actually a 10% deficit between people having a health check and people not having a health action plan that follows on from it. So that's a key area for us to look at. So just from my perspective, in supporting systems out there to sort of to contribute to improving the uptake and the quality of annual health checks, what we can do as a region, we can offer support to you, as in signposting you to resources that can actually support to increase the uptake of health checks and to increase the quality. I was actually looking for a couple of things that I could, maybe just some links that I could share with you. And, there was a publication from, you'd have probably heard of Value in People 2001. It was a white paper that was published a long time ago, and it's still very much referred to today. And in some respects, actually, a lot of the key messages in that, it's quite sad because we're still having to keep reinforcing the messages all the time that, about improving the health outcomes for people with learning disability, and that we're going back to 22 years now. You'd think you would have thought by now we would have actually mastered it, but unfortunately we haven't. So there is a health action plan booklet out there as such that basically will tell you what is a health action plan, because a lot of people get confused about what actually is the health action plan, and people think it's going to be this big, all singing, all dancing sort of document that needs to be completed, when in fact it might be something that's really quite simple for a individual. It might take the form of either a paper version or it might be a digital version. It could even be something like a text message or an email or something sent in the NHS app, depending on who the individual actually is and what degree of health actions are actually needed for that individual. And then just some useful resources in London. We've got the London Learning Disability Annual Health Check Toolkit. I don't know if you've seen that, but again, I will share the links to that. And we've worked in that for the last couple of years in London. We've had a lot of input. I think some people in this call would have inputted into that, and also people with a learning disability and carers. And that's basically about us trying to pull everything together in one place, in one document that, that clinicians can actually can download it, put it onto their systems, and they've got easy access to it. And we're planning to keep that updated every year so that it's always current. So I will put the links in to that as such. And again, just supporting people around annual health checks, health action planning. Again, it's about drawing on the services surrounding the individual as well. So within the toolkit, it has links in it to all the community learning disability teams across London as well, that again, you can draw on, because we often find that that's a problem as well. People don't know what is out there to support an individual. So therefore, the toolkit will help you to sort of find those things out. And just one very last point I'm going to make is just for anybody that wants to be a part of it, what I do as part of my role is I offer strategic clinical advice and regional support to a monthly learning disability annual health check health facilitation network. And that's basically, it's a community of practice basically for clinicians across London to come together, share learning, good practice, so that we can ultimately improve annual health checks. So again, I'll put in the links about that if you should want to join it. It's very informal and I think very beneficial to a lot of people. And that's all from me. Thank you very much. Thanks for listening.
Thank you so much, Maggie. That was really good. So Maggie, everything she talked about and all the links, you'll post them in the chat. So feel free to access them if you can, because it will really help if you're involved in the annual health check process. Okay, so now it's my turn and I'm just going to share my screen. Can you all see that? Yeah, brilliant. Okay, so we are going to look at what makes a good annual health check. Why do we do them? What our aims and outcomes are going to be for the project? What makes a good annual health check? And then because it's a small group, we're going to use it to our advantage. And I thought we can have a little discussion as to amongst ourselves what we think our main barriers are and what support would be great for us to overcome them. And then we're going to talk a little bit about the health action plans and what your role will be with regards to those, and then learning and next steps. And please feel free to come off mute and ask any questions at any time if you feel like you don't understand anything that I'm saying, or if you have any questions. Because it is such a small group, we can do things like that. So please feel free to do that if you need to. So why do we offer annual health checks? So an annual health check is offered to anyone with a learning disability over the age of 14. So amongst your practices, anyone who does have a learning disability should be on your learning disability register. So you should be able to find them via a read code search. And anyone who is identified as being on that register should be invited to have an annual health check if they're over the age of 14. And the health check should include a review of the physical health and the mental health, and it should be a joint process that's designed to help the person to make decisions about their own health and well-being. So it shouldn't be a case where they come in and the clinician just asks them a whole bunch of questions, does all the tests they need to do, and that's it. Really ask them, what do you want to take away from this annual health check? See it as a full body MRT for them. So any concerns they have can be addressed, any concerns the clinician has can be addressed, and together make decisions about their care plan and their health and their well-being and what they want to take away from it. The GP should be able to support the person to make decisions by considering the best way to deliver information. Now, this is really key in the population group that we're working with, because they're not going to have the same expectations, and they're not going to have the same requirements as you would with the general population. That's why we need to assess their level of understanding. So is it that you talk to them directly, you give them all the information and they're able to process that? Do you have to talk a bit slower? Do you have to use really basic terms, or do you communicate through the carer? You really need to establish those things first before the annual health check takes place. So a pre-health questionnaire should be done before the annual health check is done, and that's where you would gather that kind of information. You would know, do we talk to them directly? Do we talk through the carer? Do they understand some things and not certain things? What's their level of communication, and how are you going to deliver that? Really important to think about. And then when communication preferences, once the annual health check is finished, or even before the annual health check, did they want some more information about, I don't know, bowel screening, breast checks, anything like that? How are you going to deliver that information? Do you want to call them and tell them over the phone? Are you going to send them an easy read letter about it? Really important to understand what their communication preferences are and how you're going to do that. And reasonable adjustments. And everything I've just said is a term of reasonable adjustments, but in terms of like physically, what do they need? Do they need a bigger room, wheelchair access, bright lights, dim lights? Are they a bit claustrophobic? Do they want not the person that's carrying out the review to be too close to them, a bit far away? You need to find out all this information before, because if any of those reasonable adjustments are not met and the person arrives and they're in a kind of environment that they're not comfortable with, you've lost already. You're not going to be able to carry out a good annual health check, because you're not going to get the most from that patient that you need. You're not going to get the information because they're not comfortable. They might get a bit anxious. They're not used to their familiarity if you haven't provided that. So those things are really key in delivering a good annual health check, and really important to remember. So another reason why we offer annual health checks, so people with learning disabilities, as Maggie explained in her little bit, is that they often experience poorer health compared to the general population. So they do die a lot quicker. They're more exposed to other healthcare conditions like respiratory conditions, mental health conditions, constipation, things like that. Because of all those things, it's really important to get every single aspect of their health checked out through this annual health check. So in 2006, that is when the Disability Rights Commission recommended the introduction of annual health checks so that people with learning disabilities living in England and Wales were all entitled to them. And they're designed to promote healthy living and well-being, identify health issues early, organise so that referrals can be done and organised in a meaningful way, and to review medication and monitor ongoing conditions. So like I've said so many times already, it's a check of everything. We want to identify any existing issues that there are, stop new issues from occurring, and we want to monitor things that are already occurring. So, you know, everything should be looked at and everything should be treated as an important thing about their care. So the project that we're focusing on and what we want to do is to support the improvement in take up and quality of annual health checks. And like Maggie said, we're the best. We're at 88% and the national target is 75%. So we're already doing really well. But that's all good and true, but what about the quality of them? So although we're doing a good number of annual health checks, out of those 88%, how many of those patients can really walk away and say, yeah, that was a really good check, and you know, I needed to get what I wanted from that, and I got it, and I'm going to walk away feeling happy. Before this specific project, I did another project where I focused on the structured medication review aspect of the annual health check. And when I went into practices and audited what the current quality was like, it wasn't really where it should be. So I'm assuming if I did audit other aspects of the check and other things that should be monitored, not just medication, it would probably be the same. So it's really important to make sure that we're doing them, but we're doing them in the right way and in a meaningful way, and we're making sure that we keep that quality there. So we want to work in collaboration together. So I obviously work for North East London Foundation Trust, and I work with the community learning disability teams. You guys working in primary care, we need to talk to each other. So I have an involvement in their care when they are involved with the MDT, who form part of the community learning disability team, and you guys have an involvement in their care when they come for their checks with the GP practice. But are we talking to each other? Are we telling each other what we did? Are you telling us that you prescribed and that the GP prescribed some antibiotics for them the other day? Are we telling you that we changed their antipsychotic medication the other day? We're documenting it, and there's means for you to see what we document, and there's means for us to see what you document. But do we know that? Are we talking to each other? And I think that's where we really need to raise that awareness and work together a little bit more so we can deliver that care together. So we want to look at how we can engage with patients who don't attend their annual health check, and how we can support awareness and uptake of the annual health check offer. So like I said, we are doing well. I think majority of patients on the register do come for their annual health check, but what about that small population that isn't? How are we going to target them and get them on board to come for their check? And also to look at the underrepresented groups, so those younger people. So I know when you're over 18, you probably have more of a means to come, but the ones that are looked after by parents at home, age 14 to 17, do the parents know the benefit of the annual health check and how important it is to get them to come? And people at the BAME background who don't attend for their AHC, do they need a bit more support? Is there a language barrier? What can we put in place to make sure that they do come for their annual health check? And reasonable adjustments, which I will say probably 100 times during this presentation, but making sure that everyone who is involved in the care of patients with learning disabilities are able to identify and support awareness and implementation of the appropriate reasonable adjustments. So what we want to what outcomes we want from the project is to so we want to get that continue with our uptake of annual health checks being over 75%. So we're at 88%, really good. Make sure that the reasonable adjustments are being recognised and implemented. We want to demonstrate and share learning and good practice examples. So by getting you guys on board, mainly the care coordinators who are going to be involved in the health action plans and making sure that they're followed up. Share what you've learned from it. You know, give us good practice examples. For example, if there was something on a health action plan that said refer to the dietitian, and then the patient forgot about it and never did it, but you were in charge of making sure that was followed up, and you contacted the dietitian and you made sure that that referral was done, and the patient benefited from having a healthier lifestyle, their diet went better, their weight went down, you could be responsible for that. So just that little thing that you've done is a good practice example, and that can be shared to encourage other care coordinators and other staff working within the practice who are involved in the annual health check process to come on board and get those things followed up as well. To ensure access to linked priorities such as the quality structured medication reviews as part of the AHC in line with the STAMP agenda. So for those of you who aren't sure, STAMP and STAMP stands for Stop Over Medicating People, and it's a national agenda, and it's where my role kind of first came about, where we identify patients who are prescribed psychotropic medication inappropriately. So there's no mental health condition, yet they're still prescribed psychotropic medication, and we introduce reduction plans to help them come off this medication in a really safe way. We look at other ways that their challenging behaviour can be managed, so not just medication, but using other MDTs such as psychologists, behavioural specialists, occupational therapists to help them maybe engage in activities, do other things to focus on rather than exhibiting that challenging behaviour. And what we found is that that has worked really, really well. There is not that reliant on medication anymore, and the patient's quality of life improves at the same time. So that's a priority, and there are other priorities in regard to patients with learning disabilities such as cancer screening, respiratory issues, and if we can link them all together with the annual health check, then we'll be able to focus on them and make sure that the patient is given that kind of level of care across all the different priorities and areas. And we want to increase the number of completed health action plans and ensure they're always followed up. So when I did the audit for the medication review project, I did see that a lot of the health action plans were left uncompleted and not followed up. And this is what gives the payment to the surgery. So it is really important that they're done, but done really well. So, you know, it's the patient's responsibility, our responsibility, and also the clinician's responsibility to make sure that that all-round check is completed. So if they walk away with follow-ups needed to be done, we need to make sure that that is followed up. Otherwise, there's no point in having the annual health check, because if that issue emerged and was put on the plan and never dealt with, then what did the annual health check really give us? So what makes a good annual health check? Having a whole practice approach. So really, from the reception staff to the clinic room, everyone needs to understand why, how, when, etc. You all play a part in making the health check a positive experience. From when the patient walks in to reception and is greeted by whoever is greeting them and then taken to the clinic room, it all makes a difference. It all makes a difference as to how they feel, how comfortable they are, and how much information they're going to share. A learning disability lead. So it's really important for all practices to identify a clinical and an administrative lead for learning disabilities. So they can be the ones who are in charge of making sure that the learning disability register is up to date. Everyone's invited to the annual health check and helping to facilitate it and making sure that all the easy read, reasonable adjustments are done and available to the patient. So if your practice doesn't have that, it might be something to go and think about to make sure that you've got that one person who's kind of in charge of making sure that the annual health check process is robust and done in a really good way. Reasonable adjustments again. So it's really good practice to have an individual record of what the patient requires. You can get templates for this, which can be added onto the patient's notes. So just like a little A4 document that kind of says, I like a big room, or I don't like to see too many people. It will just give exactly what the patient's preferences are, and if this is already on the patient's record every time they come in, whether it be for a normal appointment or an annual health check, those reasonable adjustments are noted and can be implemented if needed. So really important to have that. Easy read resources, like I've mentioned before. So when they're invited to the appointment, how you're going to invite them? Is a telephone call sufficient? Do we need to send a letter out in picture format or easy read, just so that they understand why they're coming in and what's going to happen? And the same information, easy read resources can be given for breast screening and bowel cancer, etc. They're easily available on websites. So if you need links to that and resources of how to get that, please let me know and I can provide that to the practices. And health action plans. So obviously we'll discuss this in more detail when we move on further with the presentation, but it's really important and it's mandatory for the completion and payment. So we promote that even if there's no health needs identified, so even if the annual health check said, yep, everything's fine, there's nothing to worry about, still write that on the health action plan to say no health needs in 2021, for example, and then come 2022, it might be different, but it's really important to document that to say that we've done it. Okay, so now I want everyone to come off mute if they can and try and be as interactive as possible. And let's just talk a little bit about what we think the barriers are, and then move on to talking about what support you need to overcome them. So if in your practice, if someone has had an annual health check done, the clinician's done it, they've got all the data and they've completed a health action plan, and you've got this health action plan in front of you, what do you think the first steps are going to be? What you as care coordinators, or Rafi as you as the pharmacist in the practice would do? Don't be shy, everyone. Please come off mute and just speak. And if you don't, I'll pick on you.
So I think the main barrier, well, a barrier that I can think of would be timing. So sometimes some patients need a bit more time than others. And obviously if you've been allocated a slot, which is, let's just say 20 minutes, but it takes some time for the patient to even come into the room, that kind of eats up the time for the consultation itself. Yeah. So I think what you discussed, as in terms of finding out before the patient comes into the practice what their needs are. So actually a really good idea. Yeah, brilliant. And that is the case, Jasmine, a lot of the time, you know, they might need 10 minutes just to acclimatize to the new environment, to the new building, you know, they're not comfortable. So in that case, like you said, you find out before exactly what's needed. If they do need that, give a 1 hour slot if you have to. And I think that's easily done on our appointment booking systems, where we can just give that extra time for our patients who need that extra time. So that's facilitated, that's taken into consideration. And then when they come, you've got that leeway, you've got that bit of extra time to work with. Thank you. Are there any other barriers that we might be faced with?
Communication. You know, if something's worded too medically, the patient may not be able to comprehend. So probably more simple form of language to the patient's level, depending on what their needs are. Absolutely. Brilliant, Mary. So Mary, if someone's had their annual health check done and then their health action plan has been given to you, and Mary, you're going to follow up on this health action plan, and on it says patient has hypercholesterolemia. What would you do? I think I'd have to Google what that was. And maybe, I don't know, probably look at the notes, see how the appointment went, and then maybe see if the patient has a carer, what the needs are, and depending on the situation, either speak to the actual patient or the patient's representative as to the way forward. Brilliant. So don't use Google. Use your colleague. So if I don't know a medical abbreviation, you can use Google if there's no one else around. But I'm saying if you're in the practice and you've got your colleagues around you who should know what that word means, I would prefer if you ask them to give you a good summary of what that means and its definition. That will help your learning more, trust me. So make use of them. So if the GP comes out and hands you this paper and you have a quick read, Dr. So-and-so, can you just tell me what this means? Because I'm not sure. And if you don't feel like they've given you enough information, then go away and Google if you have to. But use them as your support and your mentors to help you get that jargon. Well, they shouldn't be using jargon. I wouldn't expect hypercholesterolemia to be on the health action plan. It should be in a more, it just means high cholesterol level, but it should be on the health action
action plan in a way that the patient and their carers can understand. So that shouldn't be on there. But if that was on there, then you're right, that would be a barrier, because you wouldn't understand, the patient probably doesn't understand, and the carers don't understand. So that would be a first kind of issue in that health action plan overall, because we've started off with something that no one understands. So use the clinician to help you, then you can explain to the patient, then you can change it, cross it out and write patient has high cholesterol, and then the follow-up might be blood test in 3 months, and then it would be your responsibility to make sure that that blood test is kind of carried up and followed through, and make sure that the patient goes for it. But yes, Mary, I like everything you said, so thank you for your input with that. That's brilliant.
Okay, thank you.
Anyone else?
Whether they have the ability to be able to actually complete what's on that health action plan.
Yeah,
so
can you give me an example?
So if their diet was one of the things, whether they have the ability to make sure that they're eating the right things, that they're doing the right things to lose the weight that they possibly may need to lose.
Yeah.
Or to better their health, things like that.
Yeah.
So whether we can support them with maybe a health and wellbeing coach to direct them in the right way. I used to do the annual health checks. I'm a HCA, so I used to do them for my old surgery.
Amazing. So what did you learn from that, Jasmine, when you did them? Or what would you, if you could
absolutely love doing them.
Oh. But if you could change something as to where they were delivered to make them better, what would you do?
So to be fair, my old surgery, the health check was done by me and then a GP.
Yeah.
And I would say that health action plans were not the best.
Yeah.
They were either not completed, like you say,
yeah,
or they were very basic, that did it actually ever benefit the patient? So I think that the health checks themselves are normally delivered pretty well. You normally have someone in surgery that does them. It is the aftercare of that. Otherwise, they end up going year to year, never being seen, nothing going on with them, apart from the regular blood tests they have to have for the medication that they're on, if they're on any, and things like that. They're kind of left, they're lost.
Yeah.
So I think it is the health action plan that it is really the problem.
Yeah.
Within health checks, not actually, well, for me personally, not actually the health check itself.
Yeah.
So that would need to be changed, like I say. And I think that the care coordinator coming in and making sure that the plan meets the needs and the ability of the patient, but also is completed within.
Absolutely. Yeah. Yeah. So exactly what you said, the annual health check is done. Okay, now what? So what? That's the health action plan. That's where it comes in to follow it through, and anything emerging from the annual health check is then followed through and take up. That's why it's so important, and so important for everyone involved in that health action plan to know timescales. How, like you said, if it was diet related, having a health and wellbeing coach, how are they going to get the issues that are identified sorted? Who do they need to go to, and what needs to be done in order for it to be followed up? That's really helpful. Thank you, Jasmine. I get one more person to speak about a barrier they think they might be faced with, and then we'll move on. Caroline? Only because I can see you. You just have to take yourself off mute.
I did have communication written down, but that's already been covered.
That's okay. You can still say it again. It could be a different example.
I'm just trying to think.
What's your role within the practice? Did you say you're a care coordinator?
Yeah, I just started in September.
Okay. And have you been involved in any annual health checks since then?
Not at the moment, no.
No? Okay. So do you have a good understanding as to what it details and what will happen and how the patient will be followed up after? Or would you say you probably need a bit more time to sit down with someone?
Yeah, I think I need a bit more sort of involvement and training about, about it, and sort of I don't think I've not actually been involved in doing part of it, but I think it is something that we are undertaking. Brilliant.
So that's good. So for someone who hasn't had any experience in doing them, what would be your main concerns if you were to, if tomorrow in your practice someone said to you, this patient has just had their annual health check done, can you go and look at their health action plan?
So obviously I'd read through it carefully and then just see the timescales and things like that, and obviously you know, as a care coordinator, try and pick those up and, you know, really try to follow through. Obviously, thinking about things that you've already said, that where things, sometimes the barriers are, or where things get, you know, lost, or that they're not followed through properly. So, yeah, just really try to read the notes and just action it.
Fantastic. And being someone who hasn't had any experience in doing them before, what support do you think you might need in able to do them confidently?
Maybe like liaise with my colleagues that have done them, and, you know, like you say about if there's words that you don't understand, you know, not be afraid to ask.
Brilliant. Good. Fantastic. Thank you so much. That was a really good discussion. Thank you to everyone who contributed to that. So let's move on to the health action plans now, because this is going to be where you guys will be involved a huge amount in this process. So once the annual health check is done, it should result in a health action plan, which should be completed, and a copy should be given to the patient and the carer if they have one, and the parent if there's a parent involved. And we should keep a copy, and it should be uploaded into their records. So the focus of the health action plan should be the key action points discussed, whether for the person, the practice, or other relevant parties involved in the person's care. It is agreed with the person and their carer during the health check. Now, you might think, okay, things that emerged from the annual health check, raised cholesterol, like I said, difficulty breathing might have to be referred to the GP again for an asthma review or something like that. They're all very patient focused, but there might be something that the practice actually has to do. So it could be, I don't know, it's gone out of my head now, but we tend to think that everything that's going on in the health action plan is to do with their health and their checks and things that need to be followed up. But it might be that the practice has to organise for a social worker to be involved, or a referral needs to be done to them to go and see them to look at their housing situation or their caring situation or the package of care that they're being delivered at this time. Sometimes we will have patients who are non-verbal, who are wheelchair bound, who have carers come in 3 to 4 times a day, who are not living in residential homes, who still might be in their own home, and that might not be relevant for them or fit for them. So it might be the practice's responsibility to then organise that care and make sure that it follows through. And that's something that needs to be put on the health action plan. So it might not be something the patient has to do at all. It's within in-house that we need to sort out, but it's still something that is an action taken from the annual health check that needs to be followed up. So it's something that's the responsibility of the clinician or of the practice, but that needs to be documented, and it will still be the care coordinator's responsibility to make sure that that's followed up and done, whether it's a case of them chasing the clinician that's involved in it or chasing the social workers, lots of phone calls, but you know, that's still something that needs to be followed up and should be documented as such. So it should summarise what was discussed and any other relevant information, what is important to the person, what their goals or outcomes are, and what they want to achieve. So it's really nice sometimes to, when the patients are verbal and they come in and you're like, how are you? And they're like, I'm fine. And then ask them, what do you want from this? What do you want to achieve? You know, and like, it's really nice when they say something like, oh, I want to, I don't know, I want to be able to go out for a walk for 1 hour and not get tired, or I want to learn how to swim, or I want to do art classes. You don't think it's your responsibility because it's not immediately health. It's not, oh, I feel this, I feel nauseous, or I've got a cough or something like that. It's a social thing, but us having the benefit of now having social prescribers within the practices is a real benefit for us, and that can be written down on the health action plan. For example, James, example of a patient, James wants to learn how to swim. And then the action could be refer to James to social prescriber to look into how he can get swimming lessons. So really nice, lovely things that is going to help the patient to achieve their goals can also form part of their health action plan and annual health check. Where the person has a personalised care plan in place, it is expected that this would also form part of the health action plan. So similar to what I've just said, we quite heavily focusing on personalised care at the moment within NHS England as well. So social prescribing is a form of that. Don't know if you've heard of personal health budgets. If the person is entitled to this, you could find out more about it within the practices and if they offer it. But what comes under that and what we can offer them as a more of a personalised approach. Yeah, that's really important to consider, as that will go onto the health action plan and should be delivered in a more personalised way if needed. So some health action plans can be created at the time of the health check using an electronic template in the GP clinical system. If this is not available, a written health action plan should be provided following the review. So across London, I know all our practices are EMIS. Correct me if I'm wrong, but I'm pretty sure they are all EMIS. And we do have the electronic health action plan on EMIS already, and that can be done electronically. But I really like it to be printed off and given to the patient and taken away with the patient. Yeah, really nice for them to have a physical copy of it so they can look at it. And when it's printed off and you're giving it to them, go through it with them so that you know that they understand exactly what you've put on it, what's going to be done, what's going to be followed up, at what time intervals, and how will they be notified that it's followed up. Yeah, so really important to make sure that they're aware of that and give them a copy physically. It could be sent to them electronically. I mean, it is an option, but I think physical is always better. I know they might lose it, so always follow it up with the electronic version if we can. So get the carer or the parent's email address and say, we can email you a copy as well. But really important to give that physical copy, I feel. So this is just a really basic little example of a health action plan. I don't have access to EMIS straight away. I actually have to physically go into the practice to get it, so I couldn't get it in time for this webinar. But the EMIS one is a landscape version, but it kind of has exactly the same. You guys have probably seen it, Jasmine, you must probably have if you worked in another GP surgery. It kind of just has the same information. So what the health need was, so what came out of the review. For example, blood tests needed in the next 1 month. What will I do? Who will help me? So we have, I forgot what it's called, but that Accurex. So we can send them a text via Accurex to book their blood test. Who will do that? Who will help them? Make sure all that information is written down, what they need to do when they get the text, etc. We will look at this again on, so if it was a blood test, give it a few weeks or so for the results to come back to the GP. Write that date down and make sure that that date is put down as an appointment in whoever that clinician is that is going to call them back and speak to them about their results. Because if it's not done, then it won't be done. So I know EMIS works via tasking, so really important to task the GP once you've followed that through and say, I've just completed the health action plan. This is what we're going to do on this date. Could you please do this? And document that in their notes too, to say that you told the GP, you told the patient, and it's exactly what's going to happen. Remember, if you don't document it, it didn't happen. Okay, so really important that we do that. But across the country, health action plans do look different, but we'll all have the same kind of information as to what the issue was, what's going to happen to follow it up, and when it's going to be followed up by. Really important, all those 3 things are filled in. So what are we going to do now? The next steps and the learning. We're going to make sure we improve the knowledge and skills surrounding the care and treatment for patients with learning disabilities. So that's where you guys come in. Whatever support you need to deliver this, to follow the health action plans through, we want to provide that for you. So give you the resources, give you the knowledge, give you a better understanding about reasonable adjustments, what you need to put into place to make sure that it can be done, personalized approaches, what skills and resources are needed to give a good review, be able to confidently complete all aspects of the annual health check and ensure patients leave the annual health check feeling that they've benefited it and have a greater understanding of their treatment is the most important thing. So we want to measure the data that comes from this project just so that we can show this is where we were when we started and this is where we are now that we've gone through with it. So how many annual health checks are completed? How many structured medication reviews are completed? If there is a patient who has a learning disability and not on the register, we've identified that, we add them to the READ code and then we add them on so that they're identified as being on the register and then invited to have an annual health check. If we're providing reasonable adjustments, how many are recorded and put in place? Have we added on all the carers' details? Because if we can't communicate to the patient directly because of barriers being non-verbal, not being able to answer questions, etc., have we got the right carers' details in place in order to get that information? Number of action plans completed, very, very important. That's going to be your focus and your role, and how many of those completed action plans are followed up, which is also really important. Okay, so I've spoken a lot. I'm now going to hand it over to Hugh and Claire just to talk about the digital side of things and how they can help us to get what we want via that. Over to you guys.
Thanks, Rizwana. So I will just share my screen. We've got, I'm just looking at the time. So we've got a few slides that I'll whiz through just to give you the overview, but then we'll send them around so you can have a look at them afterwards and just get in touch with us if there are any questions. And then I'll show you a bit of a demo so you can have a look and see, get a feel for Hear Me Now and how it actually looks and feels to use. So Hear Me Now is a communication tool provided by Maldaba, and we've been working with Delft on how that can support the carrying out of effective annual health checks. So this diagram just shows sort of a phased view of the whole process. And the point we really want to make here is that Hear Me Now allows the creation of a digital communication channel. So that's between the primary care, the GP practice, to the patient and carer, and then the other organisations who might support them. So there's an app which sits on the patient's device or the carer's device, and then staff members, so yourselves, would communicate with patients through the app just via a normal web browser. So the app, Hear Me Now, means that you're able to share the pre-appointment questionnaires. These can be easy read, they'll be multimedia, so they're more accessible and engaging for people to complete. And you can also track progress. So you can see if people are completing them. You can give them a bit of a nudge if they need to make sure these are done ahead of their appointments. And as Rizwana was saying, how important reasonable adjustments are, these can also be shared through the app ahead of the appointment, so it's as effective as possible. So the follow-up, the health action plan can be shared with the patient, carer and their wider network through the app. They can receive a digital copy of it as well as any paper copies that are useful for them to have. And it really helps them to support the carers and other people who are supporting them to implement those changes, making sure people understand the steps they need to take, and they're shared with the people who are able to help them do that. The other thing is people can sort of track and share their progress towards these goals, so showing that they really are making consistent health improvements from their health action plans. So let me just switch screens. So this is the app with a sort of demo user. So I am Becky, and I can go into my appointments. I can see that I've got my annual health check on Monday at my GP practice, and I'll also receive a reminder in the app, so I'll get a nudge to make sure I attend. I can then go into About Me, and this kind of acts as a bit of a digital health passport, but it's somewhere you can share those reasonable adjustments. So I can say how I communicate, give me lots of time when I'm speaking, and also speak slowly and explain things clearly so that I can process them properly. Then I can go into my questionnaires and I can see the questionnaire that my GP practice has sent me. So I can open this up. It's easy read, multimedia. So this is sort of just an example questionnaire, but the kind of formatting and accessibility you can see. I can see that it helps me manage my health, checking on bowel health, healthy foods, again, healthy eating and exercise. And I'm able to complete this easily within the app. I can go back to it whenever I need. And the GP receives it in advance. So the appointment can really be that kind of conversation between myself and the GP practice and whoever's carrying out my appointment. The next thing to show you is, so documents is where I can keep my health action plan. So I can go back to it and look at it whenever I need to. It's been shared with me from the GP practice, and I can go in and see, obviously when it's filled in, the health needs that we've agreed, what I'll be doing and who'll be helping me. And again, I can check in on, oh, I had a blood test a few weeks ago, we're talking about it in a few weeks, and I know that things are progressing. And finally, if I go to my home screen, so I can also make boxes here about anything that I want to. So one of the boxes I've made is my health action plan goal 1. So that was weight management. So I can go into here and I can say, this week I took my dog for a 40-minute walk. I could take a picture, I can take a video, show what I'm doing. And I can also keep track of the food that I'm eating, maybe some of the healthy choices that I'm making. And then once I'm making progress, I can maybe add in my weight measurements and track if I'm progressing towards my goal or not. And it helps sort of identify where I might need some more support if things aren't going the way that we want them to. The final thing just to highlight for you is that we also have a standard operating procedure. So Hugh's done lots of work on these, sort of planning out a consistent delivery approach so that in different practices and by different people, patients receive the same experience. And this goes all the way from starting with the Learning Disability Register search to the sharing and the creation and sharing of the health action plan. And it also does support the paper pathways as well, because we know not everybody has access to or likes using digital solutions, but it's available in both ways if people want them. That was a bit speedy, but I think we're up to time. So if anyone does have any questions or wants to get more detail, I'll share my contact details afterwards as well, and we can pick this up.
Can I just add one of the really big things in the work that we've done elsewhere is where the health action plan has been sent to the individual and their carer, whether their carer be a family member or where they live in supported living. Quite often the carer is the person that is there helping implement the health action plan, but the carer doesn't have support. So if we can provide different routes to provide the carer with support, then it's quite helpful. And because through the establishment of this digital communication channel, you can send to carers and the individual videos, text, photographs of actually how different techniques can be used to support the implementation of that health action plan. So it's quite a useful tool just to think how somebody who is informal carer can start looking at the quality of the diet, compliance, etc.
That's brilliant. Thank you, Hugh, and thank you, Claire. And I'm sorry I ate into your time a little bit. I do waffle. Does anyone have any questions about anything that was discussed today? No? That's fine. Thank you so much for joining. I hope you have found it useful. And we will be in touch about how the project will go forward. I think, had Dr. Sood gone, Summer?
Yes.
Can't see her. Yeah, she's gone. Okay. I will be in touch with Dr. Sood about how we'll take this forward. We didn't get all the PCNs joining today. So once we get a few more on board, we'll be able to come up with a structured view of how we're going to run the training program. And if we need to come out and visit you guys, and if you need a bit more support via one-on-one from a specialist who's involved in learning disabilities, or whatever you need to carry out these health action plans and follow them through, we'll be able to support you with that. So if you do think of anything and you think, oh, this might be helpful if they can come and do this for us, please don't hesitate to email us. Do they have our details, Summer?
I will be sending an email out after this with resources and contact details. So yeah.
Brilliant. Okay, so via that you can communicate with us and let us know if there's anything you need. Thank you so much for joining.